I am going to take a etiology of multiple sclerosis and its management. Now, first of all, we start with the introduction. What is the multiple sclerosis? Multiple sclerosis is a chronic immune-mediated demyelinating disorder of the central nervous system, affect brain, spinal cord, and the optic nerves. Most common cause of neurological disability in the young adults. Now, the etiology onset usually between the age of 20 to 40 years. It's a young adult. More common in the female. Female to male ratio is 2:1. More common in the northern Europe and North America. Genetic and the environmental interaction. Now the etiology, cause of multiple sclerosis. There are two main types. First is the genetic factor. HLA-A&BRD1 increase the risk of the multiple sclerosis. Family history increase the susceptibility. Immunological factor. Autoimmune attack. Variations in the B cells on the myelination of neurons. Inflammation, demyelination, and the regional damage are out of the multiple sclerosis. Continue with the environmental triggers. Its infection caused by the EBV, Epstein-Barr virus, is strongly associated. Vitamin D deficiency, low sunlight exposure, smoking, and increased risk. Other factor, gut microbiota imbalance and the obesity in the adolescents. Now the pathophysiology behind the multiple sclerosis. Genetic and the environmental triggers. Individuals with the genetic predisposition, like we further discussed with the early, are exposed to environmental factors like EBV virus and the low vitamin D deficiency. Immune system activation, trigger point active due to autoreactivity of the T cells and the B cells obeying the myelin antigens, blood-brain barrier disturbance, inflammatory response in the CNS. T cells release cytokines and the attract being more immune cells, attack on the myelin sheath. Oligodendrocytes are damaged by the immune body. Now the demyelination is the loss of the myelin sheath, show or the blow on nerve conduction velocity. Now the axonal injury, ongoing inflammation also lead up to the degeneration and the growth. Plaque formation, sclerotic lesion, plaque form in the white matter region, optic nerve, and the periventricular area of the spinal cord and the brain. Neurological degeneration, chronic demyelination and the axonal loss that lead a permanent disability in the brain atrophy. Now the clinical symptom development, depending on the lesion, location, visual, sensory, motor, cognitive, and the balance impairment, all the things are affected. Now the type of the multiple sclerosis, there is a mainly four types of the multiple sclerosis. Relapsive remitting is the more common, 85% of the cases. Secondary progressive, primary progressive, and progressive relapsing. This is the graph of the multiple sclerosis types. Now the clinical features. What are we seeing in the multiple sclerosis test? So we can see a visual disturbance due to optic neuritis, muscle weakness, spasticity sometimes, fatigue, sensory disturbance due to a nerve affection, ataxia and tremor due to motor degeneration, balance and the bowel dysfunction, and the cognitive and the emotional change we can see in the multiple sclerosis patient. This is the more common symptom. It's affect the eyes, spinal cord, hands, muscles, everything. Bowel, bladder, kidney. Now, what is the physiotherapy then balance we take a scale for the walk balance scale. Fatigue severity scale we can take. For the mobility and the gait assessment, we can do a time up and go test and a 6-minute walk test. Also we can do a short walk test. Now treatment plan based on the stages, like there are mainly 3 stages: early stage, mid stage and the last stage. It's the most severe stage. Early stage, there is a mild disability. So to the goal of the early treatment, maintain on mobility and the prevent reconditioning. It is the prevent a joint weakness to further condition progress. Now treatment. What we can give a treatment? Aerobic exercise 3 to 5 days per week, 20 to 30 minutes. Static cycle, walking and swimming. Strengthening exercise, low to moderate resistance and high repetition. Due to a muscle weakness, we have to strain muscles. Now stretch daily for the spasticity of the muscles group, like a hip flexor and the plantar flexors are more common in the spasticity of multiple sclerosis. Fatigue management, pacing technique and the energy conservation technique we have to use. And the balance in the coordination, standing balance, stand-up moving, possible supports we can give. Now in the middle stage, there is a moderate disability of the patient. Goals: maintain a function, prevent falls, address the spasticity, improve ideal performance. Now what is the treatment we have to give in the moderate case? So we have to give first of all spasticity reduction because of spasticity develop more, stretching and frozen positioning, EMF technique like a contact and relax tolerance relax technique, cryotherapy included for the patient having a pain, functional mobility training, bed mobility and the sector strength exercise, weight training with or without walker or walking like prevention of legs, core stability and posture control, functional electrical stimulation for the foot growth if present in the patient, vestibular exercise if dizziness is present. Now the next stage of the multiple sclerosis, there are the severe disability shown in the patient. So we are goals is the prevent complication like a placebo and the conjecture, promote a comfort in the caregivers training, maximize a quality of life. Now what is treatment we have to give in the last stage? Positioning and the regular bed mobility change, pacing range of motion to prevent a conjecture and the deformity, chest physiotherapy if the respiratory muscles and the respiratory movement are involved. Spring for the foot drop or the wrist deformity if the patient is placing. Assisted device like a bleacher, modification and the orthosis because of its last stage. So patient have more disability and the caregiver's education like how to transfer patient, hygiene of the patient, turning us favorites. Now the specific symptomatic based intervention. For the spasticity, we have to give a stretching, cryotherapy and a positioning to relieve a spasticity. For the fatigue, we have to give aerobic training, pacing and rest planning. For the fitness, we have to give a functional strengthening and isometric exercise. For the ataxia, we have to give a painful exercise and the weight walk. For the pain, we have to give a tense, speed therapy and soft tissue things like MFR. For the bladder dysfunction, we have to give a pelvic floor strengthening and the legal exercise. For the cognitive impairment, task-specific training and repetition we have to give. For the home exercise program, stretching for the major muscles daily like the hamstring, calf, piriformis, abductor, abductors. Walking with the assistive device like the cane walker in the wheelchairs. Breathing exercise like the positive breathing, diaphragmatic exercise. Cognitive tasks like the puzzles, memory and the balance board or the standing exercise is for the tolerance of the patient. Now the patient and family education is the most important in multiple sclerosis. Nature of the disease we have to understand and overview